well, there's no like big introduction or anything. I don't know if you've listened to any of the podcasts, but I am always interviewing people who are dying. That's the podcast. Yeah. So you're not dying that we know of right now.
Yeah, I mean, we're all dying, technically. Yeah. I don't have a diagnosis of...
You're not hospice eligible at the moment.
I'm not, no.
But I thought it would be fun to just talk to some people who are kind of experts on this process. Just kind of get some perspective from somebody else other than myself about kind of the death and dying process. And I don't know, because I think part of the deal with this podcast is trying to help people learn from the experience of other people who are going through that. Right, and part of it is just normalizing death and dying, and the more we talk about it, the better it is. And I just different people have different perspectives on it, and all perspectives I think are valuable and welcome. And so I'm eager to hear a little bit more about your experience, and just talk a little bit about your work and my work and how they intersect. And but first I want to hear a little bit about you. Where are you from? And just kind of how you grew up, maybe a little bit.
Yeah. I'm from Erie, Pennsylvania. So it's like northwest Pennsylvania by the border of like Buffalo and Canada. So it's very cold there and very snowy. And I grew up a country girl. So I grew up in a place that we call the Gully, Gully. And it's like a family property. So both my parents had 7 brothers and sisters. So there was a bunch of aunts and uncles and cousins. And a lot of my dad's family moved down into the Gully, which was like land that the family had.
Oh, cool.
So yeah, it's very cool. I grew up, like, I feel like I never had to camp. Like I don't like camping now because I like never had to, because I literally had a house in the woods. So we would like play all day. And I would be with my cousins mostly. I had a brother and sister too, but we're all like 3 years apart. So like they would have their cousins that their age, and I would have my cousins my age. So we'd all like play around the woods and creek in the Gully, and then we would.
So cool.
I know, it was the best. It was seriously the best. My sister and I still. I know, me too. My sister and I still call ourselves like Gully girls, because like you can take us out of the Gully, but you can't take the Gully out of the girls. Like I am still like country at heart, I like the woods and creeks and things like that. So that's how I grew up. Yeah, it was amazing. It was beautiful.
Do you remember being exposed to death, dying, illness, those sorts of things as a young person?
No, I don't remember being exposed to that.
Do you remember not being exposed to that?
I would say I remember. I've always been like even as a young girl, I've been fascinated about life and death. I probably wasn't saying like, where do we go when we die, but I think I was like, why are we here? What's this all about? Like, what happens when we die? Mm-hmm. My mom had a close brother of hers, her like best, like I said, she had a bunch of siblings, but the one closest to her drowned when he was 19. So by the time I was born, he had been dead for a long time. And I do remember being little and her talking about that, and her saying how he's dead and he's gone and how sad it was for her and yada, yada, yada. And me really contemplating like, well, where'd he go? What'd he do? And like trying to talk to Uncle Bill. And I remember like my sister finding a letter that I wrote to him. And it was really embarrassing because it was like, I was embarrassed that she found this letter that I wrote to my dead Uncle Bill. And my mom's just being like, oh, that's so nice. But my whole point to saying all that is that I was always fascinated by it, and always wondered like what the deal was.
What did you write to Uncle Bill?
I don't remember.
Oh,
I was so little.
Yeah.
I don't remember. I think, I wish I could remember. That's such a good question. I don't remember. I'm sure it was something, I really don't remember, so now I'm kind of making it up, but I'm sure it was along the lines of like, my mom really misses you. It makes me so sad just even thinking about it, because my mom was so, it's so clear to me even now, how much she missed him and how hurt, how much she grieved him. She still does. It's still really hard for her to talk about him. I don't know if she ever, I don't know her process of that, right? But like, I know she's always been really sad too, that like, she'll hear me tell stories about people getting signs or going to a psychic and like, getting messages. And her thing to that is always, my brother Bill never came back from, I've never gotten anything from my brother Bill. And I always pray to God to hear from him. And so I'm sure it was something along the lines of like, my mom really misses you. Like, let us know how you're doing. Something like that.
Yeah. So were you religious growing up?
No.
Okay.
My dad, if anything, my dad was like openly atheist when we were even very little.
Yeah.
My mom was very Irish Catholic, like grew up really Irish Catholic. So that was kind of instilled in us anyway. Everything wrong with Catholicism. No, I'm just kidding. All of like the Catholic guilt and shame. Just kidding. I actually really am kidding. But like she really liked the like ritualistic part of it and like the traditional part of being Catholic. So we were like baptized and had communion, and my sister and my brother were both confirmed Catholic. I was not, because let me tell you why. Because I didn't make cheerleading one year. And I was mad at God for that. And I was mad and pissed. And I told my mom, I'm quitting CCD. I'm not getting confirmed. You can't make me.
Oh,
and
I love
all
that.
because I didn't make cheerleading. I was like mad at God for that. So I didn't get confirmed. And my mom didn't make me for some reason.
Yeah, well, that's what he gets.
Exactly.
Yeah. Well, I'm just... Yeah, okay. The reason I ask all that is because I remember from a very young age, I grew up in a church where I knew everybody. Everybody knew me. My family my parents' parents went to that church. My parents went to that church.
Wow.
It was just, And so from a very young age, I had these multi-generational friendships. And, of course, as they do, the older generations died off. And I was exposed to that from a very young age. I was going to, they called them viewings, but wakes or, whatever.
Yeah.
I remember going to open casket funerals when I was 4 or 5 years old. Very young.
Wow. Yeah.
So that was a real gift for me, is being exposed in that way, where I thought I had kind of a handle on what happens after death, like going to heaven and all that. But so I didn't ever really wonder about that, and there wasn't this mystique about dead bodies or funerals or anything like that. That was a matter of course for me. So I just none of that for you, though.
No, I wouldn't say so. I do remember going to funerals and seeing dead bodies at funerals, but it's not something that like sticks out to me that like was talked about.
Yeah, it didn't like.
I did have like a lot of young friends die when I was in high school. Unfortunately, like so I had a lot of like tragedy and things like that. But but growing up, generally speaking, I don't feel like my grandparents lived till they were in their mid-90s, so I was in my 20s. So we didn't have a lot of exposure to that.
Yeah.
Yeah.
Well, okay then. Why nursing?
What if I was just like, I don't know, just stop there? Made this interview go, you're like, wow, Julie, Julie's making this rough on me.
No. I'm into it. We'll just sit here in silence. I'm a chaplain. We're good.
I know, right? Oh, Cody. Yeah, you're like, you don't need to talk. I'm cool with that. Why nursing? So, really, I was young. I had a degree in psychology. I didn't know what the hell I was doing. I was a drug addict, alcoholic. Did not know that, by the way. Thought I was just like a fun party girl. Like, this is just what I like to do. I know. I'm like, this is just what I like to do. You're a loser if you don't. Like, anyway, whatever. But
hold on, hold that thought
yeah.
for just a sec. I gotta let my dog.
Wow, was your dog there that whole time? I didn't even notice. I was just gonna say, hey, Chris, you still there? No.
That's,
Okay.
that is weird. Okay. All right.
That's what producers do.
It is
lurk.
actually.
They lurk. Yeah, exactly. They just like get shit done. I love producers. Oh my god.
Oh, it's great, and even more fun on the in-person interviews because he's just lurking right there, and I could touch him.
Okay,
right,
so drug
you
addict,
were
alcoholic.
Yeah, you were a drug addict.
I mean, I was like,
alcoholic.
whatever, high functioning. I think no one,
Sure.
People, it's really misunderstood, but, I was still in school. I still had a job. I still had all the things, whatever. But a friend of mine was going into an accelerated nursing program, which just means you can get your BSN, like your bachelor's in nursing, very quickly. So a friend of mine was doing that. I was working as a behavioral tech. I don't know why I went like that. It's real. Behavioral tech in a mental health hospital, no less. Meanwhile, I'm like a total frickin' wreck over here. And a woman had a seizure right in front of me, had a seizure, cracked her head open right in front of me, blood everywhere. And I was the first person to see her, the first person to help, and I froze and freaked out and almost became a second patient and ran away to the nurse's station. So I did get help, but I did not help her. I was panicked. I could barely speak. I was like white as a ghost. And they sat me down and I was trying to explain, like, someone go help, like blood, and I saw all these nurses running down there, and the woman did end up being okay. She had to be transferred to another unit and get like staples in her head, and it was really scary, and she ended up being fine. But I remember thinking in that moment, like, I can't believe there are people who will like run towards those things, those scary things.
Yeah.
And even though I wasn't that person in the moment, that still made me be like, I think I want to be that person who would like run towards scary things and like help people and know how to. If I knew how to, maybe I wouldn't be so scared. So it was a combination of that, and then my friend kind of already being in this program, so she was able to tell me about it. So it took me some time, probably like another year and a half, to like get the prereqs and apply and do all these different things, and then I got into nursing school. I did the same program she did, and I loved it. I was obsessed. I loved it. So that's how I got into nursing, and I'm grateful for that.
Yeah. Well, that's really cool.
Yeah.
That kind of encountering that like emergency and not reacting in the way that you wish you had, or wish you were able to, and then just being like, well, yeah, I got to do something about that. That's really cool.
Yeah.
Yeah. And also, I don't know, I talk a lot about kind of cultivating longevity and the importance of knowing your values and being able to kind of pivot back to your values as a way of directing you. And I describe values as who you want to be and how you want to be. And it seems like you were like, I want to be that. Like, that's who and how I want to be. I want to be the person that runs towards something that's scary. And so you just like made that happen, which I think is like good job. That's cool.
Yeah. I'm happy. I'm happy I did.
Yeah.
Years later.
Yeah.
Here I am.
Seems like it worked out.
Yeah. It's been really like nursing is a great career to get into, and I mean I can go on and on and on about that, but yeah.
Well,
so many avenues you could go into,
It just seems so hard, honestly. Like, I'm around nurses all the time, and it's I think it probably is, like my work, very rewarding, and also, God, it's so hard. The stuff.
Go ahead. Sorry.
Yeah, it's just like a lot of responsibility, and it's just really hard.
Yeah. I feel like, real quick, I'll try not to get too much on a soapbox here. I feel like because I've been a nurse for 16 years, which isn't that long, but long enough to have learned how to make it work for me. And like, that's the one thing I could start a whole nother platform called like trying to talk to nurses about how to make nursing work for them, because it can be so devastating to be in something that you love so much and then get so burnt out and have such compassion fatigue that you're like, I made the wrong choice. I should not have ever, maybe I'm not cut out to do this. Because that's how I felt as an ICU nurse. And then I still stayed there for like 5 more years. Like just because it's so scary to like leave what you kind of know, even if you're unhappy. And there is ego, at least for me, built into like the ICU. And I work in the ICU
Totally.
and I'm an ICU
Totally.
nurse, whatever. And I had all these grand plans to like go back to school and do all these things. And it just burnt me out so hard. And then, of course, it made me calloused and cold and sad that like something I love so much turned into something I disdained, and I didn't feel like I was, it just felt awful. But then I thankfully I had the courage to start moving around and then finding something like hospice where like it feels so different to me now. Like I feel so lucky. I actually like my job. I mean, I like going to work. And then on top of that, I think working full time as a nurse, as a full-time employee is also really hard. So I have, even before the social media stuff, let's just take all of that out. I was a per diem nurse at a corporation, basically a large conglomerate that always will need people as per diem nurses. And I basically worked full time, but as a per diem nurse. So like I could kind of come and go as I please. I didn't have to be like enmeshed in like all of the annoying things that come with being a full-time employee. Like you have to work this much on call. You have to put in this much time for your vacation, like just things like that. And it was such freedom because I basically still worked full-time, but you get paid more because you're per diem.
Right.
But you can still come and go. You only owe them X amount of hours a month. So like you can kind of work as much as you want or as little as you want, depending on what you need money-wise, right? And it's just been such a blessing. Like that's like the greatest thing I ever did for myself. And I think there's a lot of people who think, oh, I can't do that because of this, or I can't do that because of that. And I don't know. I would say try it. I would say if I know this is not what this podcast is about, but that's what I mean by soapbox. I could go on.
No,
on
it's fine,
about,
and we can, yeah.
You can cut this out too.
We can cut out whatever. But I appreciate this because I talk to nurses and resident physicians a lot about how to make this profession that they've spent a lot of time and money on, how to make it sustainable, because it's hard. And if I'm walking around and I'm, devastated by every patient that dies or is like sick, or upset by everybody that makes a decision that I wouldn't make, or whatever it is, if I get hooked in emotionally to all these things, it's not sustainable. I can't live my life like that. And I'm not a nurse, I'm not a doctor, but I work in this area, and I just know that it's so easy to get just burnt out, killed by this. But there are also people who love what they do, and I'm one of them. I love going to work. I really do. And obviously you do too. And there are ways to do this. So, that was actually one of my questions that I was going to ask, is because I think, the way that I talk about cultivating longevity is just being aware about what's going on inside of me is really important. Like, what are the emotions that I'm feeling? Let them be, but also I don't have to like over-identify with sadness or over-identify with anger. I don't have to like be overrun by these emotions. And and just like being on the lookout for things that kind of hook me in and get me like swirling in business that's not really mine. You know what I mean?
Yeah.
You know, and I think it would be really easy in the hospice world to do that, because all these people are, you know, they're dying, and a lot of them are really sweet, and you know, like you kind of, I think the kind of people that get into hospice are also really sweet and also like love people, and getting all mixed up in somebody else's drama is pretty easy in those kind of situations. So yeah, maybe we can get back to that in just a minute. But so tell me more about how you made that transition from ICU to hospice.
I mean, there was a few transitional periods, but you know, I was initially I was living in Baltimore, Maryland, where I was an ICU nurse. I took a travel nurse position to another ICU establishment in California to get to California, and I just knew I needed to transfer out of the ICU, so I was trying to find other avenues just through agency work and stuff. And then eventually I just thought, I'm just going to try being a hospice nurse. And I applied for a hospice nurse position. I mean, you just eventually do it, right? So I just applied, even though it said like must have experience.
Right. No.
Did not have experience. But I got the interview, thankfully. And I think when you really, and I was just, you know, honesty goes a long way. I remember just being like super honest in the interview. Just like, listen, I've been a nurse for, I think it was 8 years at the time or something. Like, I'm just so over being an ICU nurse. I have a passion. Being an ICU nurse has made me passionate about trying to be a hospice nurse. Like, and I just was really honest about what was going on. And I got hired. And I do think nurses, you know, nurses are needed. Like, they're needed. So
Always, yeah.
You know, it's not like super hard to get a nursing job, right? So
yeah.
I was just honest, and thankfully they hired me and took a chance on me, and that was how I did it.
So what do you like about hospice?
Oh man, I love everything about hospice. The only thing I don't love is documentation, but like even that's not that bad. Documentation is like the bane of my existence. I'm like, I didn't have to document. I could just like live free. No, I love the autonomy. I love being in my car and driving around the city, even though people think it must be awful because I live in Los Angeles, but it's really not. I mean, traffic is awful, but it's actually not during the day. I love getting to meet like all types of people, and connect with them, and I think, I don't know if it's like because people are extra vulnerable at this time or something, they're extra open, but like you're in their home, you know, I go into their homes. That can feel scary sometimes, but also like I love seeing how like other people live, and I love seeing people's homes and being with them and their families. I love, especially what I do now, because I work per diem, I mostly do admission work. So I do mostly admissions, which before I was a case manager, and I love that too, but I felt still like even hurried doing that. I hate feeling hurried. Oh, I hate it. Especially when I'm with patients. I'm like, I don't want to hurry through this. You can't like hurry up this. I want to like sit here with you. And I do feel like this place I work now, and because I mostly do admissions. I still do follow-ups and stuff too here and there, but I have so much time to spend with them, and it's like so great. So I love educating about death and dying, if you couldn't tell. There's so many things, but it's mostly the people. Mostly the people I get to meet. I wish we could I'm sure you feel this too. Of course, get it with their permission, but I wish we could show people, show the world the people that we meet. Like, they have so many cool things to say, such cool lives. Like, this one thing that's happening, which happens to be death to them, doesn't define who they are. Like, they have this, massive life where all these things have happened. It's like, oh, I just want everyone to know this part of you.
Yeah.
You know?
Of course. That's the whole reason that this podcast exists, is because I have these conversations with people who are dying, and this time in their life doesn't define who they are. It certainly affects them, and it affects them in a really nice way most of the time. It's, it really clarifies things. It makes them really pay attention to the things that are important. And it's just it's lovely. It's so great to talk to people who are coming to the end of their life and really, considering everything. I mean, they're just so no time for bullshit. They're all everything that they do is important. It's so great. It's so great. And if they're willing to give me some time,
oh my gosh,
they have limited time. What a gift!
I know. What a gift! I just had a guy the other day. Like, we just chatted about stuff. Blah 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 blah. It wasn't even like anything. We weren't even being like, "Tell me if you're afraid to die." We were like literally just like chatting about his life and stuff, right? And at the end of the visit, he like grabbed my hand and was like, "Out of all the people I'm gonna meet, I'm so happy I got to meet you." And it's like, what? I am so happy I got to meet you, sir.
Right.
That kind of shit is like what I live for. Like, I just want to do
great.
that day in, day out. Like that, and I do, and that's what's so amazing.
Right. Exactly. Yeah. I told this to probably 3 different families this week when I show up. I do a lot of work in the ICU, so I'm mostly dealing with families. And,
Cody, that's so amazing. We needed someone like you when I was in the ICU. God.
Oh yeah.
Anyway, go ahead.
No, it's okay. I'll spend time with them. They're like, "Oh my goodness, I don't know how you do this." And of course,
right.
I have my line about, this is not my dad, right? This is not my loved one that's in the bed. So this is not as hard for me as it is for you. But also, I was like, look, I get to meet you people on what is perhaps one of the worst days in your life. And look at how amazing you are. Look at how you're showing up and being loving and caring and gracious to each other and to the patient. I mean, it really is a gift to see that. It's fantastic, and I'm sure it's the same in hospice.
It is the same.
Most of the time, people show up and are awesome.
Yes. So I have a question. No pressure to. I know this is your podcast, but my
you
question
don't
for
interview
you is,
me.
Yeah, right. But I'll have to have you on my YouTube. If you don't mind.
Okay,
My
sure.
YouTube,
Yeah, absolutely.
Because my question for you is like, that's the kind of stuff, and people are like, it must be so hard, right? That, like, the stuff that can make me, it's not so hard, but the stuff that can make me like weep, like tears, like I don't cry at work, right? But if I were to cry at work, which I don't, but if I were to, it's like not tears of sadness. It's like I could weep from like seeing the beauty and love that I witnessed between families or friends or whoever is there, right? Is like, that's the part that's like, I cannot believe I get to witness this. It's like, we have a feeling of love, and I get to like witness like love in action, like what love, like as a verb,
Yeah,
and
totally.
That's the kind of shit that makes me be like, Again, I wouldn't do that, but if I could, I would. That's the stuff that would make me cry. Because it's just so beautiful. Yeah.
Well, that was this is a good time to get into that because one of the things that that I have identified as kind of an emotional hook for me, something that will kind of get into me, and if I'm not aware of it, will make me act in ways that I don't want to act. Or practice in ways I don't want to practice. There's some negative things that do that, and there are some positive things. And one of the positive things is love between siblings. When siblings show up for each other, or when siblings come together to care for a parent, just that sibling love. I love my siblings so much, and I value that, and I don't get to see them as often as I want. And so when I see that happening, it warms my heart. And if I'm not careful, I get like like I want to be in the sibling group, and then I I start to take on their emotions, and then I start to do extra stuff for them that I wouldn't do for anybody else. And that's dangerous. That's not the way I want to be, and I can't practice that way all the time. So I really try to be aware of that. So what are things? Do you have some things like that that are like emotional hooks? Do you want to tell? Do you want to tell me?
I do want to tell you.
Okay, good.
Yes, I do want to tell you, and I do the same thing. So there's good. And, I guess I've always looked at all of them as bad, and maybe they don't have to be labeled as good and bad. But like, so I'll tell you, like, yeah, if I just like connect with someone, especially like if someone's like especially sweet, or like we just happen to like connect more, or sibling love, same. My sister and I are really, really close, and we both live in Santa Monica, away from our family, far away. So we have this like intense, I don't know, I feel like an intense bond her and I have. So if I see like if I'm taking care of like an elderly woman who lives with her sister who is her caregiver, I'm instantly like, how can I help you? Like
that happened just last week.
Yes, like, what can I do for you? Like, we need,
so
I just want to. And yeah, I think it's like, my kind of default would be like, care more, give extra things.
Right.
Which again is like, great, but also, I gotta like do this, open heart with everybody, but like, so that those kind of things like can really get me. And the things that can really get me as far as like, I very rarely am like really affected by work in the sense of like, I can feel the heaviness of it, the sadness of it, where it feels like now all of a sudden I'm kind of like, poor me, which is like very I'm not really like that. If any, like, but there's one thing that can kind of get me like that. And I really hate it because it feels like self-indulgent when it's like not about me. And that's when someone is having symptoms or there's like some suffering that I'm witnessing and I can't do anything about it or at least like not in that moment. I can't, right? So like, I had a person once that I showed up to do a palliative care admission, so not even a hospice admission, and they were basically actively dying. But like I couldn't, but the family kept being like, no, he's, you probably have seen patients like this where some patients really can kind of like look like they're actively dying, but then perk up and you're kind of like, wait a minute, what the hell's going on here? Like that's what was happening with this guy. And like one second he'd be like awake and kind of talking to me and like, no, this is how I am. I just need to wake up and get moving. And then the next second he'd be like unconscious, like guppy breathing. I'd be like, what the hell? So I was like trying to like hurry things up and like get things and get oxygen and medication, and I was trying to like move things along, and it just wasn't fast enough, and he ended up dying right there. And with he ended up dying in the home, which was okay because like not okay.
Sure.
I mean, it was okay because he didn't want to go to the hospital. That was the whole point of why we were there. Like he should have been. I switched it over to a hospice admission. Like I was doing all the things right, but I couldn't do all the things fast enough.
Not fast enough, yeah.
And in my opinion, he had a bad death. And what was even harder is that he was super gracious in like the last moments of life, like literally being like, thank you, like, say, just like using like last breath to like say thank you for like covering up with a blanket. Like just like things where I'm like, oh my God. And the family was just like, thank you for being here. No one was like freaking out. And I wasn't freaking out outwardly, but inwardly I was like, what the hell is going on? And I remember just like going home that day and just like crying and crying and crying and crying, which I never really do from work. And like, it was hard for me to go to work the next day. I could just feel like the heaviness. So sometimes when situations, those things very rarely pop up, and it's pretty normal to like probably feel like that. But I just don't like the feeling because it feels like I'm feeling sorry for myself. And it's like, he's the one who suffered and died, not me. Why am I feeling sorry for myself? It's like I'm sorry for myself that I had to witness it or something. I don't know. It's just a crummy feeling. And it feels like self-indulgent, I guess.
Yeah, I guess. But you're kind of, I don't know. You're in a helpless situation.
Yeah, it's like the helplessness feeling that it feels
It's terrible.
so
It's a terrible
bad.
place to be. Yeah.
It feels so bad.
Yeah.
And then it kind of turns into like, poor me. Like that's the part I don't like, is that if it's really bad, I turn it into this whole like, today was a bad day at work. Like, people feel sorry for me, and it's like, oh, I don't like how that feels.
Yeah.
But I go there, but I
Sure.
do it anyway,
Sure. Yeah. Are
So,
there things, I mean, I have like I don't want to say I don't like, but I have a hard time with people who are like overtly racist, or people who are like
Totally.
no, just like
You made a video.
overly entitled.
I think you made a video about this. I feel like I might have commented. I swear
maybe
I
so.
remember you
Yeah,
talking
yeah.
about this.
Probably. But yeah, I mean, there are things like that I just have these biases, but I have to show up and work for them too, and so I have to kind of, I mean, it's just a matter of like being aware. Carl Jung said, you have to make the unconscious conscious, or it will drive you, and you'll call it fate. And it's just,
Carl Jung,
if I'm not aware of the things that are going on inside of me, then I just like, I'll just be mean back to a person, and like I shouldn't be doing that. I should be more aware, be more in control of my responses. Are there particular things like that that kind of stick in your craw?
Yes, and you hit it
Racist.
on the head. I mean,
Yeah.
I have very few people that are overtly racist. Thank God. I mean, I feel like that's built into our culture, but like, which is also horrific. But because, I mean, I think people, there's entitlement everywhere. And then I also live in Los Angeles, where there's incredible wealth, which is fine, and not everyone incredibly wealthy is entitled. There's people who aren't incredibly wealthy and they still act entitled. But
right.
but like there's something about like incredibly wealthy too that also seems to sometimes take on that entitlement, and sometimes it's a little hard too, because my work will even be like, this is a VIP, or well, let this person on because their daughter's the president of da 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 da, and it's like,
Nope.
I will literally be like, no, I will not. Like, if you want to put someone on hospice, even though they're not appropriate, that's fine. But I'm not going to be the nurse to do it, because I'm not giving anyone special favors. But then meanwhile, I'm also kind of being like not as nice to the person.
Right.
I mean, because of the bias,
right.
because I'm like, they think
The other way
something
around.
special,
Right,
and it's like,
right.
oh, I don't want to do that either.
Yep.
I don't want to do that
Yeah,
either.
right,
And I
that's
try
right.
I try really, really hard not to, because I do see it so clearly. I can like feel it inside me, being like that. So, but
Yeah.
I will really put my foot down if like someone is, if like work is telling me to be that way. I will just be like, I'm not your nurse. Then you got to find another nurse, because I'm not doing it.
Ugh. I yelled at a VP who told me that somebody was a VIP in the hospital. I was like, that's great. I'm sure that he's going to get the great care that everybody else gets.
Yes.
Not playing that game.
No, not playing that game. Don't get me started.
Hate that.
Oy, oy,
Okay.
oy. Okay. We're on the same page. We're on the same page, Cody.
We concur. All right.
Yeah.
All right. So, normalizing death and dying. Let's talk about some things that you think people get wrong about hospice. Common misconceptions.
That we just the main, there's several, even people in the healthcare profession will think that like, oh, it's not time yet for hospice. It's always like, oh, it's not time yet. It's like, what? The hospice is the last 6 months of life. Like, it is time sometimes.
Yeah. Right. Yeah.
Like people going on to hospice too late. I always say like hospice, and I don't know if I've actually thought of this. I'm sure someone else said it, and now I'm just saying it. But like, hospice is about living, and I say that. And I think people think I say that like in a cheesy way. I really mean it. It's about life. It's about living out the rest of your life. And it's really hard to do that in a hospital.
Yeah, right.
So I also want people to do whatever it is they want to do, but it's just like I want them to know that that's like an option and what it truly
Right.
means. And the other thing is like we just drug people up. It's like really couldn't be further from the truth. We help manage symptoms, and a lot of times people haven't had their symptoms managed very well, and they come on hospice, and because our utmost goal is comfort, right? So I always say, like, very rarely are we just like pumping people full of medications if they are not. Very rarely, never. We're not pumping anyone full of medications if they're not saying they're in pain or they're agitated or whatever, right? A lot of times people who are like drugged up on hospice is because they had tons and tons of symptoms that needed managed, that were unmanaged. So you have to give them a lot to get them comfortable. So those are the two big ones, I think, really understanding that hospice is about living and quality of life over quantity of life. And it's 6 months or less, not 1 week or less to live, and we don't drug people up until they die. Literally, it's like clinically proven. Hospice does not hasten death. Neither does morphine. Morphine gets a really bad rap.
Right.
But it's been clinically proven that people on morphine with the same disease don't die any sooner than people who are not on morphine. They just die more peacefully.
Right.
So.
Right. Yeah. I mean, I've seen. We make referrals to hospice all the time, and when we're doing that, we often start comfort care in the hospital, and people feel so much better when they stop doing all the things that they've been doing and that are not, by the way, going to prolong their life, and start treating symptoms in a way that helps them live a comfortable life until they can't. And I mean, I know it was a long time ago. It was I think it was like 2008 was when the study was done. But there was a study that showed breast cancer survival rates were higher for people that had that went to hospice, which that's obviously it was a long time ago, but still that's impressive,
Yes.
And people, I wish that there wasn't so much talk about, you're going to beat this, you're going to fight this. The war metaphors, it just doesn't do anything for me. I don't think it's a great way to talk about living a life.
I also think because people are so, and again, like people are so afraid or just don't want to contemplate their own mortality. So when they're faced with it, hearing any physician, and again, and not to put any blame because everyone's just doing their job, I guess, right? So hearing any physician be like, we're getting towards, the end of treatment options. Like we're running out of treatment options, right? However they want to say it. And then, but then it'll be like, but we could try. I guess we could try this or something, right? And it's like, I just feel like almost anyone, because they don't know any better, are like, okay, okay. But really, it's like I go through this in my book and on my YouTube about like what to ask your doctor. Like, well, what does this mean? Like, is it really going to give me any kind of percentage of life, and how much, and what's a quality? And there's just so many things to ask, because there's so many times when I've seen patients come onto hospice, they're usually younger, and I get it. Maybe that's why they're doing all the things. Yeah. Or I can tell they're a week or two from death and ish, right? And they'll be like, my oncologist said, I just need to take a break because I'm kind of weak. Maybe I'll get my strength up and I can try another round of chemo. And I'm thinking, I don't know, I don't know the circumstance. Maybe there was something else said, I don't know. But I'm thinking like, I know this doctor can look at this patient after years of doing what they're doing, and I know they know that they're dying. Right. Why the F hasn't this been said yet? Yeah. And of course, I will say it. I will say it very kindly and compassionately, because I want them to understand what's truly happening to themselves. Yeah. But like that stuff gets me really fired up.
Yeah. Yeah. Yeah, it gets me fired up too. I wish, I mean, obviously I'm not an oncologist and I don't
I
carry
know,
the
right?
burden of,
And like I wasn't there. Like maybe they did say all the things. Like I have no
well,
idea.
who knows? Who knows what they said? But I mean, I know that's got to be a difficult place, and you're like, you are the keeper of all the magic, right? All the magic
Yeah.
chemotherapy, all the magic immunotherapy, and like you don't want to be seen as a person that's taking something away from somebody that is hoping to live. And
But I think they are. Not to interrupt you. I think they are taking something away
well,
because
right,
they're
and
not because they're not being like that. They're doing people, whoever they are. I mean, our culture in general, not one person, not oncologists, but like we're doing a disservice for most people, I think, because
Yeah.
I think healthcare workers, I know in the ICU, we could tell when someone was not going to get out of the ICU.
yeah,
And we would let it go on for far too long before we finally were like, I guess we should say something, and that was a long time ago too. Maybe things have changed, yada, yada, I don't know. But like, we got to get better. We got to get better.
yeah, and I think that it's also well, I have a whole soapbox I get on about communication in healthcare and how it's not really valued very much, and that's really what our team does. Is
Yeah.
especially in the hospital is communicate. We're trying to help people understand what's happening and help them ask good questions about their health care. And, nobody's teaching communication in, well, I don't know, maybe they are, but nobody's learning communication in med school, and nobody's learning it as well as I think they could in residency. At least in my hospital, I think we could do a better job of that. But yeah, I mean, just like asking these questions. Okay, well, I'm not a candidate right now for more chemotherapy. Am I ever going to be a candidate again? That, and what does that take? Oh, I'm going to have to be well enough to walk into the clinic to get chemotherapy. I can't see that happening. Like,
I know.
Can somebody tell them these things? Can somebody tell them that they have, like a 10% response rate, and that the response is that it would just not grow a little bit more
right.
for a little bit longer, and that you're going to have all these symptoms, and yes, the chemotherapy is going to make you sick, and I don't know. It's not great. Not great.
Yeah.
But
yeah.
Maybe it's getting better. I did listen to an oncologist talk to a patient not long ago, where he said, look, I know we've been really trying to prolong your life with everything we're doing, and all of these medications that I've given you have been in that vein, where we're really trying to prolong your life. And now I know that anything I give you is going to shorten your life, and so I'm not going to do that, because I know that's not what you want. You want to live as long as possible, and so we're going to set you up with hospice. I mean,
okay, there we
yeah,
go.
I mean, that was really nice, and
that was great.
And of course, this patient has been with that oncologist for a very long time. They trust them. They know that they're not going to lie to them, and yeah, of course, they were like, yeah, great, hospice, let's do it. Yeah.
Yeah. I think we need to know, like, and again, like you said, I mean, it's a really good point. Like, I'm not an oncologist, but I'm not an oncologist. So, yeah, but like knowing when to and even if you do continue treatment, still having that palliative care team there to kind of prepare for the what ifs, what if you go downhill quickly? What if you decline suddenly? Just to get the things in order so chaos doesn't exude if something does happen.
Yeah. And we don't want to make these choices or decisions in a moment of emergency.
Right.
Talk about it ahead of time.
Right. Okay.
Oh.
If we're all fired up, we're like, what?
Yeah. We're gonna fight now.
Yeah.
Okay.
Getting your blood pressure
All right. Well, let's do something a little more lighthearted.
up. Okay. Great.
What are some of the worst platitudes that you've heard people say to people who are dying? Have you heard any really bad things?
I mean, basically anyone who says like when someone says like, and it hasn't always been like, well, as a hospice nurse, just like even out in the world, people being like, I think it's, my mom's really sick. She's tried a bunch of chemo. She's elderly. I think this is like, who knows what's going to happen, but it seems like she's getting close, whatever, yada, yada. And then someone will be like, I've heard there's a really good new treatment out there that like anyone that offers any kind of like unsolicited like health care advice where you're like, okay. Or someone who's like, well, oh my God, my mom is, I love you, Mom, but she won't listen to this. But she is the worst. She'll be like, well, at least they lived for a long time, or like the whole like at least at least you have another child.
Ooh.
Do you know what I mean? Like insane shit. My mom when I was little used to always go, this is like a little off topic, but she'd be like, at least you're not blind, Julie. Like I would like tell her something that was wrong with me for the day. At least you're not blind. I was like, what? I'm telling you, I'm sad. It doesn't matter if I can see.
At least you're not blind.
So like anything like that, like at least this, at least that, like I know people mean well. But in general, it's like I just think it's always best to be quiet.
Yeah.
Or ask what they might need. Mm-hmm. Or even just be honest. I always say just be honest. Like you can even say, I don't know what to say, but I just want to be here for you.
Yeah.
I just want to be here. I don't know what to say. I feel scared
That's
too.
great.
I feel sad too.
Oh,
or whatever,
That's the best. That's the best.
Yeah.
The best thing to say.
Yeah.
I don't know what to say, but I just want to be here with you. Oh,
I know.
So sweet. Oh, there was a guy who was... he had COPD or ILD or something, and he was having trouble breathing, and was going to go to hospice. And he didn't have any family. He had these friends from church that were kind of helping him through, and he was just saying how much he really wished he had longer to live, but he just doesn't think he can do this anymore, and he just needs to go home and he needs to be comfortable. And his friend it made me cry at the moment. He said, "Brother, I see you and I hear you." I was like, "Oh man, that's so great!" Oh,
like,
it was really cool.
Oh, like slow clap in the back. You're like, thank
so
you.
Great. Yeah.
So good. Yeah. Any families that just like support their loved one and in whatever way they can is like always so great too.
Yeah.
I had one time like thinking of like things that are like, I had like a caregiver who was such a great caregiver. She was so amazing. And I live in California where you can take the end of life medication if you meet criteria and like all the things. And there was a guy that was talking to me about it. He was a patient and saying how he was possibly interested in it, And the caregiver heard this and came running in. No. You don't need that. I'll take care of you. You're just sad. You're just lonely. Like I'll pray for you. We'll pray. And I'm like, oh, like I loved her, but I like took her aside later, being like, girl, you can't. Like I'm not gonna like. I don't care if he takes it or not. Like I'm not pushing my opinion on him, but you can't push your opinion on him either. You're a wonderful caregiver, but that's not your choice.
Right.
It's hard enough. It is hard enough what he's going through.
Yeah.
It's like, oh. I know.
Have you had a lot of patients take the we call it medical aid in dying here?
Medical aid in dying, yeah.
Yeah.
We call it. I always call it death with dignity, but it's that's my bad. It's medical aid in dying. We had the place the specific place I work, which I always keep a mystery because I have to. But I've worked at 2 different hospices. One was like not involved in it at all. I didn't even know existed, even though in California. And this one happens to be like really involved in it. So the person will always get the medication before they come on hospice, so they don't have to pay for it.
Right.
But yeah, we just happen to have like a lot of doctors that are involved, so we see it. I would say we see it like quite a bit. And if any hospice patient of ours, we can't mention it as an option, but if they say something about it, then we can offer it as an option. And yeah.
In your experience, do people who get the medication use it often, or would half and half, or more use it or more don't use it?
More use it.
Really?
More use it.
Okay.
Yeah. I only had one woman, and she did eventually use it actually, but she had it for a very long time, and we weren't sure if she was going to use it. But almost everyone that I don't know everyone, but anyone that I've ever like was with or heard of, they all, very rarely do I hear that they just like hang on to it. But you don't have to take it.
Right. Yeah. I think I don't know where I heard this. Maybe I just made it up, but I thought I had heard that a lot of people get it and get the medication and have it and then end up not using it because, for whatever reason, they don't feel like they need it. They're comfortable enough on the hospice. They got to a point where they couldn't take it themselves anymore, and so then they couldn't take it. I've had several patients say to me, I'm going to get this. I don't think I'll use it, but I want to have it for peace of mind. Like if things start to get so bad that I can't take it anymore, I want to have it. But I was curious. All right. Yeah, we're going to start toward wrapping things up. I've taken enough of your time, but just a couple of more things I want to get into. So, this is a big question, but you can talk as much or as little about it as you want. But I know that working where I work has, and doing this podcast actually, has really changed the way that I kind of approach life, the way that I see, my interactions with family and friends, the things that I think are important. How has working in hospice affected you just out in your life? So many ways. One, it's amazing when you love your job. So that has affected me because I really do love my job. So I always feel so grateful and so lucky, and I've learned so much about boundaries and like how to have a life outside of work, even though I like it, so just so many things it has taught me on that level. And then so many things it's taught me about, seeing people who were able to die somewhat, pretty peacefully, and like what they did to be able to do that. And mostly what I saw were people who were able and willing to talk about the fact that they were dying, even if it wasn't positive. Like, even if it wasn't like they had it all together and they were like, I don't care, I'm at peace. It's like, no, just even if they, until they died, kept saying like, I don't want to, or I'm afraid, they still seem to die more peacefully. And that helps me, people die the way they lived. And it reminds me of that. So then I try to remember that, like, there's a lot of surrender, there's a lot of letting go, there's a lot of like really needing to accept help and be able to lean on people, and that's difficult for me. That's difficult for me to do in everyday life, and I think about that. If I get to live and then die on something like hospice, which I think would be amazing, I need to work on learning how to let others take care of me, and ask for help if I need it. So it's things like that it's really taught me about life too. Like I think about like my most fulfilling days on earth are like
leaving a patient's house that I've just like connected with about who knows what. But you feel that connection. Like, it doesn't have to be anything profound. It could be someone just talking about like their living room furniture and us laughing together about it, and like leaving the house being like this. And I always think this is like what life is about. It's about this. It's about like connecting with other people. We are all one. We're all in this together. And then it helps me want to connect with people in my life that are in my actual life, not just strangers on the street. I mean, it's nice to connect with them too, but
Sure.
just so much stuff. Makes me really grateful.
Do you find the idea of acceptance and surrender that you were talking about, you're seeing your patients that died well, they're peacefully, are the ones that have kind of that kind of thing, peace, surrender, acceptance. Do you find yourself, I mean, thinking about acceptance and surrender in your own life? And do you think that knowing all of your patients are going to die and forming that bond with them, that connection with them, and then knowingly, because you know that they are going to die, do you think that that's helped your ability to kind of do the acceptance surrender thing?
I mean, I think acceptance and surrender, I think just in my everyday life, which hospice has helped me with, that's like an everyday practice. That's like an everyday, that's like an ongoing thing that I have to like really maintain, like in the day I'm in, that also is like in recovery and all the things. It all ties together.
Sure.
But like that is something I have to practice like on a daily basis, because it's so easy to like get caught up in like the everyday thing of life, right? Like the hamster wheel of life to take you out of that. So like patients really help remind me back into it, and I'm doing that all the time, so it's really helpful. And then as far as like the acceptance around like other people dying, and I think because I was an ICU nurse for so long, and like seeing a different way to die, and it just seemed so different and so hard, and there was so much suffering and pain, and I mean, like emotional pain too, like the anguish of not being prepared and like all different things, that like knowing my patients on hospice, even though they're all going to die, I'm like, I'm okay with that, because it doesn't feel as, again, like you said, this isn't my mother that I'm losing, right?
Yeah.
At least not yet. So like the grief isn't fully there, and because they're not my loved one, and I am happy that they are. If you're going to die anyway, dying a natural death on hospice can be as peaceful, as they come, and like you're prepared and your family's there, and however you do it. So it doesn't make me totally sad. It makes me like. Yeah. I'm like honored that I can be a part of that journey, and like it's like a sacred journey in my opinion. And there's worse ways. I mean, I feel insensitive saying that, right? Like there's worse ways to go. It's like I'm not the one dying, so like it's easy for me to say that.
Sure.
But I don't know. It's been beautiful in my experience. Like I don't really get sad knowing that all my patients are going to die. Like we're all going to die. That is the one thing I really understand. Like I don't know if everyone actually does. I think they all kind of deny it. Not everybody, but like I really have it in my core that like I'm gonna die, and it can be tomorrow, and so is my sister, and so are the people I love. Like we're all gonna die. I really understand that in my core, and that's helped me in life. Just live a little more free.
Yeah.
So.
Yeah, I think that's one less thing that you kind of have to hold on to. Tightly. Like I don't have to hold on or fight against the idea. I don't have to hold on to the idea that we're going to live forever, or fight against the idea that we're all going to die, because I see it all the time. Right?
Yeah. And the more we resist, the more it persists, right? The more we resist that. Like I think there's something about, I mean, actually Carl Jung said that, didn't he? The more, whatever you resist persists, I think. Anyway, someone said it.
Well, I know he said it. I know Deepak Chopra says it all the time. Like, if you don't want to come back as a toad, you'll come back as a toad.
Yeah.
Whatever you resist persists. That's right.
Yeah,
It's
and
true.
I just think you hang on to this fear. You don't talk about the fear because you're afraid, but really, like, the resistance of that, the not talking about it, is what makes it grow and like really become a thing. When really, if you just said the scary thing, it doesn't make it go away. You know, you're still going to be human, but like, it does take some of like the claws. You know, it takes the claws out of you.
Totally.
Yeah.
I tell that to anybody that'll listen, but you know, the more you talk about it, the less power it has. It's absolutely true.
Yeah.
So I'm guessing that I was going to ask if you had a choice between having a sudden death or a slow death, which would you choose? But it sounds like a slow death where you could, you know, say goodbye and have a little time to see it coming.
Yeah, I would say slow death.
Prefer? Yeah.
Yeah, slow death. Mostly for my family. Like, not because I want them to watch me suffer, but because like I know the, you know, I only know the pain of sudden death from grief from a grief standpoint, and that's tough. I mean, it's all tough, but like the whole sudden someone's here then not is like, oh, that's mind blowing always.
Yeah,
but
it is.
So I would think I would like the slow death, but you know what? If I don't get that, it's okay too. I'm okay.
Yeah.
You heard it here first, folks. I'm okay.
Julie's okay.
I'm okay.
Yeah, and I want people to come and like hang out with me.
Yeah.
I had a question that popped up and I didn't write it down. Give me a
Isn't
sec.
that funny? Then of course you can't. Okay, yeah. Go try to remember it.
No, you can talk. Life after death, afterlife. Yeah. Yes. No. Maybe.
I think yes.
Different thoughts on different days.
No, I think there's definitely an afterlife. But I'm not one to push that on anyone. Because I know I don't really know, and if I'm wrong, I'm wrong. Oh well, you know what I mean. That's like I don't have like
Well,
I don't have
know.
like I won't know. I don't have like a strong belief in the sense of like I'm right. Like I would never be those people that I see in my comments being like, if you don't know Jesus, you're going to hell. Like or just like that's not how much I believe in something where I would like condemn other people if they didn't. Right.
Sure.
And I don't believe in hell or anything like that. I do think we're all going to like a good place, and it feels like home. That's what I think. I really feel like, and I feel like I've gotten that message over and over and over again throughout my life, even since I've been a little girl, that you know I have been homesick for a place that I have forgotten. Like since I've been little, I have a feeling of homesickness, and I think that is because I'm not really home. Home is when I die, and when I get there, I'm going to remember that I've always been there, if that makes sense. And I try to remember that like in my everyday life because I feel like I can also be there here and now, just in the present moment. So, yeah, that's what I think. That's what I think.
That's
I think
really
we're
nice.
all in for something great, you know. And if
like
we're not,
that.
you know, if we're not, I think the worst case scenario is we are unconscious, so there's no consciousness, so we're not even going to know.
Right. Yeah. Right.
We think it's going to be scary. It's not scary. There's no consciousness. It wasn't scary before we were born, right? We don't remember.
Not that I remember.
Not that I remember. I don't remember 1970. Didn't feel scary, right? So that's the worst case scenario.
No.
Best case
That's
scenario,
right. Yeah.
I'm right, and we're all going home.
My thoughts on the afterlife they're constantly shifting, but I'm on a swing right now where I'm feeling like, there's probably something that happens afterwards. But I think I'm with you in that, in this idea that if I think that there's something good afterwards, and I have that kind of hope that something good is going to happen, and I die with that and nothing happens, well, what's the loss? I mean, what did I lose out on? Nothing. I just lived a little bit more hopeful life. That's not bad.
Yeah. Right.
Yeah. All right. Last thing, I ask everybody this, all of the dying patients that I talk to. So, hospice nurse Julie is coming to the end of her life. How do you want to be remembered?
There's so many things. I guess I'd want to be remembered as someone that made you feel like safe to be yourself around, like safe and accepted, and like you had fun. Like it felt good. It felt good to be around me. Even if it was, if we're just laughing or having fun, whatever it is. I'd hope you'd feel like I accepted you and I loved you, and I was like a person that made you feel good to be around.
Love it.
Yeah.
Good stuff.
Yeah.
All right. I think we did it. Do you feel like we did it?
I think we did it. We did it.
Anything else that you want to say?
I have a book.
Yes, plug your book.
I need to plug my book. I need to plug my book.
You've been doing your recording for the audiobook.
Yeah, it's torture. I have to go back tomorrow. It's torture. I didn't know. Well, thank you so much for taking the time to talk after a day of nothing but talking. This is easy.
Yeah, I'm sure. I'm sure it's much easier.
Oral reading is not easy.
It's like my nightmare in high school.
Exactly. It's a fucking nightmare. And then two people being like on this little sound thing, Julie, that's not actually what it says. It says,
no.
Yeah, because I fucking read everything fucking backwards. Because I can't see and comprehend with my eyes.
Oh no.
I'm like, I have a straight up learning disability. For sure. I mean, like, whatever. I'm not like making fun of that. It's just like, that. No. I've just never, I grew up in the 80s. We didn't diagnose ourselves with those things.
Yep.
I don't know how I made it through school.
It's impressive.
Seriously.
Yeah.
Anyway. So it's hard. But yes, I'm going to pitch my book. So my book is coming out. My book is coming out June 11th. It's out for pre-order now. Pre-orders are always important, I've been told. I'm learning.
Oh, yeah, right.
Yes. So the book is called Nothing to Fear, Demystifying Death to Live More Fully. And it's my little baby. And it basically is like an educational book with like stories interwoven, so it doesn't feel like a textbook. But it's not meant to really, you don't have to read it cover to cover. You could like look at the chapters and go like, oh, I want to read about this thing right here. And so it's just really great. It's basically everything I educate about, I feel like, everything I educate about with like nice, heartwarming stories in between to make it not boring. Yeah.
Yes.
Yeah.
Love it.
Thank you.
That's very cool. I'm excited to get it. I'm going to get the audiobook though, so you better hurry up.
Oh my God, the audiobook. Good luck anyone who gets the audiobook. I'm so curious how this is going to sound. Hopefully they make it sound good. There was one story I could not stop crying. Like I'm not a crier, but I mean, I don't know. Am I a crier? Maybe I am. But like there's one story I was so surprised that like it was like alligator tears. Like I could not. So, but they kept being like, no, this is good. Just let it go. And then I'm thinking, it's going to sound like I'm crying on the book. but I guess
right.
Like they don't care. I don't know. So I guess
I'm
we'll
interested to hear this.
Yeah, me too. I'm interested in hearing how it sounds. Yeah.
Yeah.
So,
well, the producer people are great. So,
Chris,
I'm sure they'll do a great job. But I'm going to pre-order the audiobook.
Thank you.
As soon as we're done.
I can send you a book too. Don't buy a book. I can talk to my publishers and see if they can send you one.
Cool.
Or I can give you a computer one. See, what the fuck?
Yeah.
I can't.
You're gonna send me a Google Doc.
I feel like I'm like 70. I'm like a computer one.
Well, I'm gonna use one of my Audible credits and pre-order your book.
Okay.
So you get you
Thanks,
need a pre-order.
Cody.
Yeah. You
Thanks,
need
Cody.
the one pre-order from me.
That's right. I do.
Yeah. All right. Well, I would love to talk on your YouTube channel. That would be fun.
Yeah, I'll let you know. It'll
let's
be
do that.
sometime we'll get a time, hopefully in May. I'll let you
Yeah,
know.
great.
I'm really bad at
Sure.
organizing things, but I'm going to try.
Cool.
Because I want a chaplain on there. And then it'll be good. I'll just ask
Yeah,
you a bunch
great.
of questions.
Awesome.
All right.
Well, thank you so much.
Thank you so much.